I really think that our clinician first model is a big part of this picture because, again, we are operating in an environment where I think a lot of competitors are trying to say, hey, we're going to take the clinician out of the loop. And you understand why they would do that because it's the hardest part of the system to scale over time, and especially making sure you get the best quality clinician talent and then educate them on the latest science, which is constantly evolving. That's a big part of the picture for how we establish credibility.
Welcome back to Tank Talks. I'm your host, Matt Cohen, founder and managing partner of Ripple Ventures. And today we've got an exciting episode with you with a trailblazer in health tech. We're talking with Sameer Dhar, co-founder and CEO of NiaHealth, an Edmonton-based startup that is revolutionizing preventative healthcare. On the back of his recent seed financing round and over $8 million in total funding, Nia is on a mission to empower Canadians to own their health outcomes through accessible, clinical-backed testing and personalized insights. With a subscription model that complements our public system, they've already expanded and they've got over 12,000 people on their waitlist. Sameer is no stranger to building impactful companies. He's a serial entrepreneur who previously founded SensaSure, an elder care startup acquired by a global giant Essity, where he famously spent a year living in a nursing home to try to understand his users better. He's a Schwarzman Scholar, recognized as one of Canada's top 20 under 20 and Edmonton's top 40 under 40. And in this episode, we'll explore his entrepreneurial journey, Nia's rapid growth, business models, the challenges of innovating in Canada's healthcare landscape, and the strategic financing he took in order to get to his vision of driving an AI-driven healthcare optimization tool. Now let's jump into the tank for this week's episode with Sameer Dhar from NiaHealth. Hey everyone, before we dive into today's Tank Talk, a quick word from our sponsor, Fasken. If you're an early stage founder navigating the legal side of startups, chances are you'll need someone like Will Shaw in your corner. Will is a partner at Fasken, and he is here to help us break down some of the common startup legal questions we get all the time. What other things do you think founders should do to be prepared for the unexpected?
One of the things they can do, especially in the M&A context, hire some good advisors too. Like bring in an M&A advisor, for example, to help you navigate the negotiating the commercial side of the deal or the financial side of the deal. Make sure you've got a good finance team. And if you don't have a super strong finance team who's helped you through acquisitions, work with an outside advisor who can help you on the finance side with getting your financial statements in order. Again, all of this stuff is easier the earlier you bring the advisors in, and they can really help you avoid some unexpected outcomes down the road.
Will, we always refer to your team as like that outsourced in-house counsel for startups. Can you explain what that looks like in practice for someone who's maybe never worked with the Fasken team before?
We think about when you have in-house counsel, you're not concerned about calling them. You're not concerned about, going to them and talking about your risks. And we want to play that role for early stage companies. So we want founders to call us. And that means we need to generate a special kind of relationship where you feel comfortable calling us and we can have those really candid, strategic conversations. And that we're going to be there to help assess those risks and to do it in a practical way where we're not worried about boiling the legal ocean. We're worried about how do we make sure the company gets from point A to point B, and what do we really need to do today?
Yeah, Fasken's also super active in the startup scene here in Canada. You're a part of CDL, Techstars, Founder Fuel. Why is that so important to you and the team at Fasken?
It kind of comes back to a core value we have, which is just be helpful. It's been a core value the team's had predating me. It's just something that the firm does too. And I think about if you're part of the technology ecosystem in Canada, you have an obligation to give back. You have an obligation to get involved and support the founders. It's really hard to build a business these days, especially hard to build a business over the last couple of years. We're there because we want to be helpful. We want to educate people. We want to make sure that they're not stepping on legal landmines. I was just doing another presentation this morning. We do lots of presentations, lots of free office hours. We want to be out there and be helpful.
Yeah, you guys have also been a part of so many founder success stories. Before we wrap up, Will, I would love it if you can share maybe one big founder tip for anyone out there who's trying to get their startup to the next level, whether it's the next funding round or the next exit. What are one of the things that you see the best founders do to make those things become a reality?
The best founders that we work with, they just surround themselves with good people. It's good counsel, it's good investors, it's good advisors, it's people who've been there before, they've done it, they have experience. they're practical, and really their interests are aligned and they're all rowing in the same direction.
Yeah, these are awesome insights, Will. Thank you so much to you and the Fasken team for supporting Tank Talks. All right, now let's get into today's episode. Thanks for joining us in the tank today, Sameer.
Great to be here. Thanks for having me on.
Yeah, super excited to chat with you about your journey, navigating the ecosystem of entrepreneurship, but also how you're trying to fix healthcare. But before we jump into that, if you give our audience a brief background on yourself, where you grew up and the journey you went on to becoming a serial entrepreneur.
Yeah, for sure. So I was born and raised in Edmonton. Thought I was going to be an investment banker going through university, did a BCom. Realized very quickly through a series of financial institution internships during my degree that wasn't necessarily the right path for me. I kind of came out of university not really clear on what to do next. I would say that Next 36, as part of the broader suite of Next Canada's programs, was a transformational experience for me. They picked 36 graduating undergrads, give you seed funding to start up a tech venture. And that was my initial foray into entrepreneurship. Kind of kicked off my journey with my first company, Sensasure, which we built and sold. And then, has led to the next journey here, trying to solve the proactive health or reactive kind of medicine crisis that we have in Canada and other geographies globally with NiaHealth. So it's been an incredible ride full of lots of adventures, which I'm excited to share more about. But yeah, that's a little bit about me.
That's awesome. We have a lot of Next 36 alumni in our portfolio, in our community. For our listeners who don't know much about it and why it's been so impactful in the ecosystem, can you share, how you even found out about it, what the experience actually taught you, and where you think it got you if you didn't go through that program? Like, would you even be a founder yourself?
Yeah, I mean, I would, the answer to your last part of your question is definitely not. I think I credit Next 36 to launching my career in entrepreneurship, if you can call it that. It is an incredible program where you don't necessarily have to have a viewpoint on technology or entrepreneurship coming in, but it's meant to be about building founder capacity in Canada. And so for me, I didn't know anything about tech or entrepreneurship coming in as a 19 or 20-year-old, but it allowed me to kind of get into the ecosystem, learn kind of the process for coming up with an idea, interrogating the assumptions behind that idea, building that idea out. And then ultimately, as I mentioned earlier, it launched me into my first entrepreneurial journey, which was Sensasure.
Yeah, unbelievable what they've created and continue to contribute to the ecosystem. I'm glad that it is still paying off, obviously, in your life. You talk about Sensasure. For some of our listeners who may never have heard of it, it was an elder care startup that you got acquired by Essity, I believe you pronounce it. Talk about that journey, the time you spent in nursing homes for a year, understanding the pain points with users. Not the most glamorous place to spend your time as a young entrepreneur versus vibe coding maybe, but tell us, what was that like?
I didn't even use the term vibe coding 10 years ago, at least not that I was familiar with. But yeah, Sensasure, we built a sensor-based solution to managing incontinence in nursing home settings. So basically, it was a sensor you put on the outside of adult incontinence products or adult diapers, tracked if elders soil themselves, and then wirelessly told nursing staff if they needed to be changed. And as you mentioned, I actually physically lived at 3 different nursing homes across North America for 12 months while we were building that company out. And that instilled in me the kind of principle that you really need to be close to your users all throughout your journey, but definitely important at the start. Especially when you don't know anything about a space. That's the best way to embed yourself and really understand what users need, what they want, and kind of iterate on your product in real time, so that the end output is something that is useful and something that will be adopted by that user base.
Yeah, I think obviously not a startup problem that a lot of young entrepreneurs think about solving. I don't really want to get into the messiness of how you even came up with this idea, but I want to understand sort of where did you find the best quote unquote ICP customers to like open up about this pain point? And how did you think about not trying to drive the business in the direction you wanted to take it versus where your customers needed it to be?
Yeah, I mean, I think that is one of the advantages of not knowing a space before you kind of tackle a problem in it, because you have this humility that you don't actually know a whole lot about it. And so you're able to more objectively kind of see and iterate on what the market needs and wants. And in terms of like finding the kind of pain point, I think it's an interesting journey, because at 20 years old, I didn't even know what incontinence meant when I started the journey. Yeah, even right now, I don't know if I can spell it. But yeah, it was a journey of going and talking to a ton of different stakeholders in the space, or geriatricians, care home administrators, nursing staff, and starting conversations out saying, hey, I want to solve problems in this space. Can you tell me about where you have pain points? And then it was them who elucidated that issue and concept to me. So I think it was a super kind of cool reflection to say, hey, you can really not know anything about a space, but by having the curiosity and commitment to understanding first principles, what problems look like and why they exist, that you can identify something and then potentially have come up with a solution and go on a journey to try to solve that problem.
I love that. I think the customer discovery process as a young entrepreneur is probably the most overlooked and underhyped journey to go on as an entrepreneur. Like, how fortunate were you at the end of the day to have that luxury to be able to learn from people firsthand?
Yeah, I think it's super important, but with a key caveat that I've only learned the second time around, because it took me 4 years between businesses to actually get into my next business, NiaHealth, which I'm building now. And one of the nuance that I want to share on this is that customer discovery is important, but it only gets you so far. And what I mean by that is that it'll allow you to understand and develop some empathy for your customers and understand, hey, here's what the potential of this idea or pain point or product offering could look like. But ultimately, you have to take a bet, right? You have to take a bet on trying something and putting something out there into the world, because you'll only get so far through talking to customers. It's a starting point, but it can also become paralyzing, especially as you get older and you say, hey, I know all the reasons now why something might not work.
Exactly.
Through doing customer discovery. And then you end up in these endless customer discovery loops, which I see a lot of founders, especially since customer discovery has become more and more popularized as the best way to, start a process of finding an idea or working on a problem. It can be paralyzing as well. So the nuance there is you have to take a bet at certain points and be comfortable with the risks that you're inevitably going to uncover through a process like doing customer discovery.
Absolutely. Analysis paralysis is something you don't want to end up being stuck in the mud on as a discovery goes on and on and on. You don't actually make a bet. So you made a bet and it paid off. You obviously had your company SensaSure acquired by a global hygiene giant, Essity. That must have been a big win for you on your very first one. Big lessons from that experience before we roll into how you took some time to reflect before getting started on Nia.
Yeah, I mean, I think it was a privilege, and honestly, it was a great acquisition and post-acquisition experience. A lot of people talk about earnouts being failed and just in general acquisitions not necessarily working out a lot of the times for bigger companies. But even for us as young founders, spending a couple of years with Essity post-acquisition, it was a great company with great values that we had uncovered during the process of talking to them pre-acquisition. And it was kind of special. Maybe we got spoiled in the sense that it actually worked out even after the fact. And that product is now a part of their core offering to nursing homes in more geographies than just North America. Actually, most of the traction there is in Europe. So
fantastic, and kudos to you to getting that off the ground and seeing those earnouts pay off also. So you took some time off and you came up with this idea to start and revolutionize Canadian healthcare. Walk us through that process. How did it all get started thinking about NiaHealth, and what is the concept that you really came up with day one?
Yeah, so I think it's the personal reflection for me was coming out of living at nursing homes for 12 months. I became galvanized to say, how do we keep people healthy as long as possible, and ideally, lessen the need and for institutional elder care at the end of life. And so, if you kind of work that problem backwards, prevention is obviously better than kind of reactivity or chronic disease development at the end of life. And prevention starts almost at any age, right? It's a confluence of lifestyle being the biggest driver, but also other kind of variables, selective pharmacotherapy, et cetera, depending on your risk profile. And so I think what would happen for me in that 4-year process, I tried a whole bunch of different ideas around this problem set, as well as others that identified through the living at nursing homes experience. And I think this concept ultimately emerged from, number one, seeing post-pandemic, more of a skepticism or appreciation that people needed to own their own healthcare in a different way than maybe they had before. Less of a reliance, perhaps, on the broader system to kind of manage their own health needs. I think, secondly, there's been a pull from the market. You read books like Outlive, which is one of my favorites by Peter Attia. And you see, wow, there's an actual movement that initially started on the fringes, but is becoming more and more mainstream around longevity, proactive health, prevention, and how a consumer, an individual user anywhere can own their health in a way in which maybe they couldn't or didn't have the information or tools or resources to do before. And then, it again, that process started with customer discovery, started with talking to a ton of potential users across age cohorts, and saw that, wow, this is really something that's becoming increasingly top of mind for a number. Actually, it's not just one ICP, and it's a number of different ICPs across the age spectrum. And so, one thing led to another, and as you just kept going down the path, this one you pulled on the thread, and more and more kind of momentum got built towards this concept. So NiaHealth today is Canada's leading proactive health partner. So we'll facilitate advanced diagnostics, starting with blood work, but also including VO2 max, DEXA scans, gut microbiome, continuous glucose monitoring. The list goes on. So the starting point of our proactive health platform is these diagnostics, which we then pair together with your medical history, clinician in a loop review, and consultation to come up with the pressing threats to your health span and longevity as it stands today, and the most actionable set of things that you can do to get in front of that risk. And then once you have that plan, we have a number of features built around how, actually actioning it, right? So how do you transition to primary care as necessary? Wearable integrations. So, for lifestyle considerations, how do we help gamify the experience so that you actually, take some of those lifestyle measures, actions to reduce your risk. And then, it's an ongoing journey it's a super exciting journey where we're continuing to develop the platform into a bigger and bigger part of people's proactive health journeys.
It's absolutely incredible. Obviously, this stuff has been pretty popular in the US for quite some time. We haven't seen this a lot in Canada just yet. It's been pretty small niche kind of players kind of popping up. Obviously, someone myself who I've gone from an Apple Watch to a Whoop to an Oura Ring to an 8 Sleep, trying to be as in touch with my own diagnostics. But then you still have to touch the system that exists today to get a lot of this stuff done. So, you guys exited stealth in April 25. You had massive demand and a 12,000 person wait list. Talk to us about how this new age version of healthcare still has to intertwine itself with the legacy infrastructure of our existing healthcare model, and how the model can evolve and bring that old legacy model to where you want it to be, and how hard that is going to be for you.
Well, yeah, that's been a crucial point of consideration, and I think now differentiation with our approach versus other players in the space globally, because we have bet completely on a clinician first model, partly for this reason, because to your point about how do you integrate with the system and have credibility, both with consumers, but other actors in the system who need to be involved in a patient or client's care journey. after having gotten an assessment, right? So the starting point is nurse practitioner driven model, people who are fluent in both medicine and people. And so, licensed clinicians reviewing the data, every single report, co-creating an action plan. We also have, as part of our product offering, every single person gets a letter to their primary care provider for any follow-ups that might be required.
What if they don't have a primary care provider?
Right. So 20% of Canadians don't have a primary care provider, but 80% do. So let's just start there, which is the easy transition is work fairly effectively for the vast majority of our customers today is take that letter in. It's all done by Canadian guidelines with deep respect for the Canadian public health system to say, hey, here's what we found. Here's what we're recommending as next steps to a public system. And we found people are able to get the transitional care that they require. For those that don't have a primary care provider, it's very situation dependent. So the range of options could look like anything, like take that letter to your nearest walk-in clinic. In certain cases, we've helped secure a primary care provider for our customer base. In certain cases, we'll look at ordering some of the labs through the public system through our clinician experience, and we're very intent upon making sure that even if you don't have access to primary care, if you need a next step through the public system, we will fight to help you get that one way or the other.
I mean, absolutely. I think there's a huge momentum behind that. You've got Prenuvo, which is obviously something that people who have the money to afford it can do it.
Yeah.
You've got, calcium CT scans that people are talking about getting.
Yep.
Walk us through the model that you've created that gets people started, and then where do they go to from there? Like, does it become like a MedCan eventually? You've got this $299 to $12.99 annual subscription models. What's included in all that, and where can it get to?
Yeah, so we're super excited to be the most accessibly priced provider of prevention in the country today. So it starts all of our assessments. All of our assessments start with a blood-based diagnostic. So we'll send a phlebotomist to your house or office, take your blood, screen for 40 to 60 biomarkers on our base panels, and between your medical history plus those biomarker readings, we'll say, hey, here's your biggest risks to health span, and here's the top 3 things or 4 things that you can do today. That might include lifestyle, that might include pharmacotherapy, that it might include supplementation, et cetera, to reduce your risk profile over time. And I think one of the big things we've done is created a super consumer friendly experience where you can go onto our dashboard and in very consumer friendly, non-medicalese terms, understand what these different markers mean and how, from a narrative perspective, this impacts your kind of overall health trajectory. And so I think that's been a big unlock in and of itself, is creating this consumer friendly experience in a healthcare setting that's used to kind of, highly kind of technical medical terms that you end up having to throw in a GPT and try to understand a bunch of these things for yourself. Whereas we're trying to, again, empower, educate the consumer to understand what these different risks actually mean for their lives, and then catalyze behavior change and behavior change being, the next action or set of actions that they can take to drive the most impact immediately. Right. So yeah, I think that's the starting point. And then for follow-on blood, whether it be follow-on blood work, other types of testing that might be warranted. As I mentioned, if it can be done through the public system, that's, we always want people to go back to their primary care provider to get the kind of continuity of care with the public system as necessary. And we're really positioned ourselves and designed our panels in the way that we look at a person's health profile to be very complementary to what the public system currently offers. So we're trying to do the things in a way that the public system just right now is not set up to do on a kind of more reactive model of medicine.
Do you think this becomes like a Canadian version of what Brian Johnson is doing with like Blueprint, where you've got this supplement line, you've got a longevity mixture, you've got all these things? Because I think the hardest thing for a lot of people is, like you said, is like you get all this medical mumbo jumbo in a report and you don't really know where to take action. Yeah.
So I think it's super interesting because we on one hand, we want to ensure that people get the follow-up next steps that they need as seamlessly as possible. And so we're kind of setting ourselves up to help people get those. But at the same time, we don't want to become a provider that's making their business model predicated on pushing supplements, as an example.
Of course.
So we don't have any affiliate kind of revenue model or relationship with these follow-on providers as next steps, because we want to maintain our integrity and clinical integrity, as well as just integrity as a business, and most importantly, win the trust of the customer to be their partner for life as they go through their proactive health journey. Because the starting point, to your point about just getting a report, you don't want to get this dashboard and then never come back and not throw it away. The whole value really gets created when you take action. You come back 6 to 12 months later for your redraw or your kind of next set of tests, and you see the kind of changes reflected in your blood work or other markers. And so that then becomes this kind of new model of healthcare where you're on top of your stats, right? Like, what your metrics are, where your risks lie, and you can see the impact that your actions have on your risk in a very objective way. And that only happens if you invest in the journey over time.
Obviously, like, trust is the most important thing when it comes to healthcare and practicing, what you preach. But, in a country that has a public healthcare system, NiaHealth has faced some decent social media criticism around this sort of private healthcare model. How are you addressing these concerns, and how are you building that trust as a preventative complement to the existing system we have in Canada?
Yeah, so I really think that our clinician first model is a big part of this picture. Because again, we're operating in an environment where I think a lot of competitors are trying to say, hey, we're going to take the clinician out of the loop. And you understand why they would do that, because it's the hardest part of the system to scale over time, and especially making sure you get the best quality clinician talent and then educate them on the latest science, which is constantly evolving. That's a big part of the picture for how we establish credibility, because we got licensed clinicians behind every single report. Every single biomarker on the blood side requisition has a clinician's license standing behind it. And so, we're practicing good care as a starting point. That's point one. I think point two, in terms of how we are kind of committed, regardless of what the hype might say, to evidence-based testing. So we're not going to just follow the hype and say, hey, somebody wants this new test that some thought leader talked about, the other day. We have our own in-house clinician research team headed up by a PhD endocrinologist practicing clinician, where we're looking at the literature on a daily basis to understand what makes sense to actually test, what's actionable and efficacious, and we can safely kind of actually test with follow-up steps that the public system doesn't get overburdened with, a bunch of false positives, for example, that are going to just upset everybody and people won't get the next steps that they need. So I think that's another piece, is our commitment to doing the homework ourselves, being very transparent about the research that we've done and why we've included the things we have and how we've interpreted risk profiles based on the evidence. And then I just think on the third level, we are committed to access, right? So we're not here to price gouge consumers. Like as I mentioned earlier, we're the most accessibly priced provider in the country. $299 is our starting point, and we know that too over time is still not good enough, right? So we're trying to continuously find ways to get this to millions of people, drive price points down across the board, bring other payers into the mix. So, whether it be insurers, we're trying to build our case for government. We're currently doing a study with the University of Alberta on some of our first responder communities that we're working with to basically build the case, the evidence base for how we can help drive outcomes and reduce costs for the overall system. So our kind of commitment on that level, on that third level as well, to being a responsible actor within a broader system has been present from the very beginning of our journey.
Yeah, makes sense. I mean, my life insurance provider provides an annual blood test at home every year for me to get, whatever I want biomarkers, sent back to me. Obviously, that's something that insurance companies would love to have, as an offering. So it makes sense for them to be partners for you.
and actually, like that's actually a great example because we've had a number of cases in our first several thousand users where they actually were able to reduce their life insurance
Exactly.
premiums after having shown the progress through our testing. So there's a whole bunch of ways in which we can help create value for the broader system and for individuals' pocketbooks.
I saw your interview on BNM Bloomberg. You talked about how healthcare isn't broken. It just has blind spots in Canada. What are those blind spots we have, and how is NiaHealth kind of empowering its users to own their own outcomes while filling in those blind spots?
Yeah, so I think one of the big blind spots is that our system as a universal healthcare system, and it's not just Canada, it's broadly across the Western world at least, it was built on a reactive model of medicine. So we'll tell you when you already have disease or, when you're kind of basically at that point where you might even need medication and whatnot. And whereas what we're trying to do is help prevent disease or identify the risks for disease developing a decade, 2 decades in advance. So it actually, it kind of flips the script in terms of us trying to identify risk early, empower users to understand what that risk means, take action on it, and then hopefully like reduce the overall stress on the system later down the line. So that in a sense is like the biggest blind spot right now. Is everybody knows that, or there's a lot of acceptance that prevention is better than treatment after disease occurs, but actioning that in a Canadian system and just any broad healthcare system in the Western world today is very challenging, given limited funding dollars and increasing burden of healthcare on systems globally with an aging population. And so, to us, the duty to the system is how do we fill in that gap, and how do we complement the great work that so many providers do, not just here in Canada but globally, in this kind of more reactive model of medicine.
Who do you look up to in the healthcare ecosystem as a shining star of what you want to become? Is there like a European country, Asian countries that have something that you would like to empower in your own sort of journey in navigating the Canadian healthcare ecosystem?
I don't know if I actually have the perfect reference point from a global perspective to say that, these folks have truly figured it out. I think as we look globally, we're seeing a lot of this type of movement towards empowering individuals and helping individual consumers understand and take action on their health, which we are grateful and privileged to be a part of that movement. From a systems level perspective, I think that as a consequence of higher tax rates and maybe lower populations and less geographic distribution, the Scandinavian countries are seem to be doing interesting things in many spectrums of care.
They just take a lot of
health.
saunas, I think, and cold baths.
Yeah, exactly. But to replicate that type of some of the models that they're able to employ because of the higher tax revenue base and just some of those geographic and population considerations, much more challenging. So again, our bet is we have to figure this out together as a global community and figure out ways in which system players through government, insurers, and private actors like ourselves who are trying to innovate at the fringes and empower individuals can together basically drive towards a new model of healthcare for all.
Yeah, I mean, this wouldn't be a podcast in 2025. I didn't ask you about the role of AI in how it can bring efficiency and productivity gains to your own company's vision. But you've made a statement to say you're trying to avoid taking out the clinician from the process. Like the clinician in the loop is what you're focused on. But there's got to be a vision for what AI's role can be in optimizing whatever it is between longevity, biomarker analysis, health span analysis, things like that.
Yeah.
So what is your vision in incorporating AI for the next, 5 years or so in your NIA model?
Yeah. So AI at the highest level for us has 2 key functions. One is for clinicians. It makes them far more effective and efficient, and deliver higher quality output every single time. Right. So AI's role in making the clinician far more impactful, effective, and efficient, and making the ability for one clinician to serve orders of magnitude more clients or patients than what they might be able to do in a public system type setting in kind of like an analog setting today. I think that's one of the biggest unlocks. I think the second is for the client experience is how do you create through leveraging AI experiences for clients that become more personalized, customized to their health situation and individual journey. And then with the ultimate goal of them taking action or being more likely to take action, which is a good outcome both for individuals and the system. I think those are the two buckets of areas in which AI becomes important. I think where I differentiate our approach versus some of the other players globally in the space is that they're very intent on taking the clinician as completely out of the loop, basically as much as possible. And, this AI doctor or physician or clinician in your pocket is kind of this catchphrase that's taken hold in some quarters, which is the vision of the world that we're not betting on, at least for the next 5 years.
I don't think there's anything worse for a doctor than hearing from their patient, I spoke to Dr. Google and they told me I should do this.
Yeah, exactly. Yeah.
So you got to avoid that, I think, in a way.
Yeah, that's why we're taking the stance that we are, and the bets that we have been taking have been based on a clinician first.
Do you
model.
think, though, with the ways in which AI is getting to a scale where it's going to have the entire world's data at its fingertips, and it'll be smarter pretty much than any doctor in the world because of how much it can consume, it will get to a point where it actually should have the trust, or will it never have the full context window for an individual's care?
Where this becomes hard for me to project out, but I'll tell you based on I personally concierge the first 2,000 customer experiences, and you just getting a dashboard report gets you maybe 50% of the way there. And let's just say that we get to a point where every single time taking the clinician out of the loop, you're able to get to your point, better quality, robustness of analysis and, not missing things, et cetera. Let's just say that were to happen at some point. That still does not answer the riddle of taking that next step and coaching somebody to really understand in their own personal context, speaking to a human to get that next step. And I would say to you, it's interesting because we've had a number of customers now who've done testing with some of our competitors south of the border who don't have a clinician in the loop and don't have a clinician consult, for example, baked in as part of their experience. And every single time they come back to us and they say, well, this was just a far superior experience because of that clinician interaction, the ability to understand and then have a human to human kind of view of what to do next. And so I find that latter part in particular super challenging to imagine how AI is just going to be able to change that and without sacrificing, people's propensity to actually take action.
I think that's just all summed up in one word: empathy. I think the clinician's empathy towards a patient's personal decisions are going to be personal, and they can't be given to you by an Optimus robot. And I think that's what you're basically saying. You're projecting to reach 100,000 Canadian users by the end of next year, with 80% of growth coming from the consumer side, and you're seeing 30% month over month growth. What is the key driver in getting people to follow you and get interested in using you? Like, how are you going to reach, I don't know, 50% of the population? It's going to be tough, but tell us how you think about it.
Well, first of all, 100,000 users is not quite 50% of the population, but to your point, it's a big thing that we think about all the time. And I think we look at how we build this business out in a few phases. So the first phase is just the consumer pull that we're seeing in the market. We have tens of thousands of customers on a wait list across the country now. We're in every province other than Quebec at this point. And so there is a certain desire that we're seeing from consumers to pay out of pocket and pay directly for this type of care. That's stage one. I would say that the second stage is we're actively, as I mentioned earlier, building the case towards other payers getting involved. So I think the second stage, which again we're making headway on even now, is with insurers and other carriers to come in and be involved as part of the payer landscape, which I think unlocks another level of scale. And then I think especially in a single payer context, I'll make a statement to say that we're already the most efficient provider of prevention in Canada today.
Wow.
So if you take that to be true, then the ultimate cost burden is on government, right? So as much as, nobody or people are kind of reticent to bet a strategy on government being the ultimate payer, I do think that in a single payer system, if we believe in it, if we continue to invest in it and believe in it in a Canadian context, that it makes a whole lot of sense. It makes a whole lot of sense for government to eventually become part of the equation.
100%. I mean, I'll say it for you, maybe not for you, but I've always said that a two-tiered system can work in a structured way. And the structure that I have always, thought about is you have clinicians and doctors required to spend a minimum amount of hours on the public system. And whatever they want to do privately after hours, after they've contributed their time to the public system, they can do on their own. Right. And I think that's what clinicians would want.
Yeah. I think the other thing too is that if we play out our vision at scale, it would significantly reduce the burden on the public system, right? Like that is the ultimate endpoint of what it is that we're trying to do here. And so this to me is a big fix and a big complement to how our current model works, because then it'll increase capacity kind of downstream in the system. If
Preventative medicine has always been something that people have said will be a reduction on the primary system. But until you have the understanding that people cannot treat emergency rooms as family doctors, I think that is the first thing. And I think systems like yours could maybe act as that kind of blocker. In other ways, we have companies that are doing the same thing on nurse practitioners, offering that kind of support through mobile apps or 24/7 text-based support, things like that. There is ways to do it, and I think we're not too far off. But the big one to unlock is just giving the freedom for clinicians to do what they want on their free time while also supporting the public good, is my opinion on that. You've raised capital from all Canadian investors. You raised a 5.75 seed round led by our great friends at Golden Ventures. Talk to us about keeping the cap table local. How has that Canadian story strengthened your position in healthcare?
Yeah, so I think that for us, it's been a super important part of our narrative to be built in Canada for Canadians. And so even when it came to raising capital, we were cognizant of that and wanted to honor that kind of heritage that we're building. And so, like it has been a big driving factor of wanting to take Canadian investors. Our friends at Golden Ventures led this round. Previous free seed round was led by Version 1 Ventures, another awesome VC.
Canadian. Yeah,
exactly. So to us, it's been an important part of the journey for sure.
Yeah, fantastic. And with global ambitions like a U.S. expansion, do you think there is a way to let global investors into a business like this eventually?
I do think that. I think at this stage, all options are on the table, and our cap table is like totally Canadian at this point. So, as we scale, if it becomes harder to access capital with larger funding requirements as we scale, we'll have to look at those kind of global capital pools as part of our option set. But yeah, for now, we're super excited to be Canadian.
Awesome. Well, good. Great luck on the next few years in your journey. Before we wrap things up, we always ask our guests for their fast favorites. So first off, your favorite podcast?
Peter Attia's Drive podcast.
How often do you listen to Peter Attia? All the time?
I would say once every week to once every 2 weeks, probably. I'm still playing catch up, to be honest. There's a lot of content out there, but we're super excited about him as a thought leader, and honestly, just his own personal role in this company's development through, a number of us as co-founders read Outlive and see that as one of the, Bibles of the movement, if you will. I think 20 years from now, it would probably be looked at as one of those pinnacle texts. And so, we love a lot of the stuff that he puts out.
Have you ever met him?
I have not. No, even though he's Canadian. He's Canadian. We've not had the opportunity.
He went to Queens.
I know.
You got to meet him.
I know. Got to do that. Maybe you can hook me up, Matt.
I'll hook you up. You got to play the Canadian angle on that. Okay. Favorite newsletter or blog?
The Daily Stoic is the one ever since the pandemic. It's just something I read every morning. I find it to be a super grounding grounding kind of newsletter blog that from an overall life perspective, it sets me up for success every day.
I've been waiting to ask you this one. What is your favorite tech gadget?
I would say my Aura ring. We've tried a ton of different wearables, and we integrate with a lot of different wearables at Nia, but particularly for sleep, which is something that I still struggle with as a founder. I find it to be the best sleep tracker on the market today, and it's just like super uninvasive and something that has got enough battery life where you're not, every day having to plug it in, and so it's something that I personally found valuable when trying to understand my own sleep patterns, and the impact of different, whether it be exercise, alcohol, anything that you might be doing, how that impacts your sleep on a daily basis.
So we had a conversation at our dinner last night with a bunch of founders about the same thing, because some people had the Whoop, some people had the Apple Watch, the Aura. I've gone through all of them. I've given my family the Aura, my wife the Whoop. I'm still back on the Apple Watch, and I have the 8 Sleep mattress. What have you changed though? So you know that alcohol is bad. You know that staying up late or whatever is bad. What have you done to physically change the way this data has demonstrated things that you didn't know before?
Yeah. So, I mean, for me, it's never like completely perfect. I'll just say that and I think that's one of the things when you think about getting this to millions of people. Everybody, knows that alcohol is not necessarily good for you. But to suggest, even with people who are, clients of ours, heavy drinkers, to suggest they should go from 20 drinks a week to 0, and then, propose that, we know that's not going to, for a lot of people, that's not necessarily going to happen. So I myself am fit into that cohort, but what I can say from like a habitual kind of shifting of my habits, I would say that, things like trying not to drink within a few hours of sleeping, it's made a huge difference to my overall sleep quality. It's funny having a glass of wine at lunch is much better for my overall sleep quality than the evening affairs. I would say, even on an exercise level, certain types of exercise, I find that doing strength training in the evening is okay for my sleep, but if I'm doing like a bunch of zone 2 or like a long run at the end of the day, it's not a recipe for success for me, from a sleep perspective. And yeah, like I think the other thing too is just seeing, in real time your kind of eating habits and how those can shift, with different types of meals. And I think I didn't mention this as another wearable or gadget that I really appreciate, but the continuous glucose monitor.
I was going to say, it has to be.
Was such a massive unlock for me. Like realizing that, starting by my meal by eating a bunch of protein actually allowed me to have some of the carbs, which I enjoyed towards the end of the meal, and not have massive glucose spikes or glucose response. So something small, like a tweak like that, I think these are also kind of important shifts that I've made. And I mean, all these things that I just mentioned to you, they sound kind of innocuous or kind of trite in some ways, but if you add them all up, it starts to create a significant difference in your overall health trajectory. Like through doing some of the things I just mentioned, I literally took my, based on my A1C, my risk of getting diabetes down by 300% within 6 months. So I think these types of change, they add up, and then they can make a huge difference on your overall risk profile.
Good for you. Yeah, those are very, very actionable things that I think people can do if they have the will. But just to summarize, obviously the alcohol consumption, the time of day in which you do exercises, the zones that you want to target for working out, as well as the style of meals that you want to eat, can all be determined and pinpointed by using these trackers.
Yeah.
Awesome. Next is
without being overly cumbersome too, right? Because I think everybody gets worried about, I want to enjoy my life, and we want everyone to enjoy their life too. But it's just amazing how, you can do it. You can get some of these insights fairly quickly, and then, institute the change, and you don't necessarily have to track every little thing all the time. Right. And if you're getting off base or you're starting to put on weight, whatever, then you can start to rejig your practices and look at the data again. So, I mean, everybody does it a bit differently. We have the biohacker types who are tracking everything all the time. That's not me personally. But I think, that's the beauty of leveraging a platform like Nia's, but also, these different gadgets and tools that have emerged in ways that work for you.
Absolutely. There's no magic pill, but there's definitely a path that you can follow the breadcrumbs on. No pun intended. Next is your favorite new trend. I think I know this one.
I gotta say, it's definitely the health span longevity trend. I'd be inauthentic if I didn't say that, right?
Okay. How about your favorite book?
Favorite book for the past 10 or 15 years has been Man's Search for Meaning. That book is just something that, like, I've probably read it 15 or 20 times, like once a year. Just, you always find something new in it. And I find a lot of solace and grounding in reading that book.
Oh, I love it. And last but not least, your favorite life lesson.
I would sum it up by just saying it is not the critic who counts. Although that quote by Teddy Roosevelt is probably my all-time favorite. Have it memorized, have it posted above my bedside table. And I mean, as an entrepreneur, it's super important to be able to form your own opinions and have the courage to follow those opinions. But the humility at the same time to kind of listen to the critics, but be able to make your own decisions. So that's something that I think has always been an important life lesson for me.
Fantastic. Wise words to live by. Thanks so much for joining us in the tank today, Sameer from NiaHealth.
Thank you, Matt. Pleasure being here.